Welcome to another video. In this video, I'm going to cover anticoagulation medications. And there are two objectives for this video. The first one is to know the common reasons these anticoagulation medications are used for. And the second objective is to know where on the clotting cascade these medications work. So let's jump into the first objective. So what are the anticoagulation medication used for? So anticoagulation medication, they are used for two purposes. The first one is basically to prevent a new clot from forming. And the second objective is basically to prevent an existing clot from becoming a larger one. So anticoagulation medication, they do not break an existing clot. The only thing they can do is just to make it stay as it is and not become a larger one. So let's say we have a clot here in the leg. So what these anticoagulation would do is they will keep this clot small and not becoming larger, because as this clot becomes larger, pieces of this clot may divide and travel to other part of the body, let's say to the lung, and can cause other issues. So what are the common conditions these anticoagulation medications are used for? So there are a couple of different conditions. So let's start with the first one. If we, let's say, have a clot here in the leg, if we have an existing clot in the leg, this anticoagulation medication will keep this clot small and not become a larger one. As this clot becoming a larger one can travel to the other parts of the body, just like I mentioned, and cause other issues. In this case, if the clot is here in the leg, this condition is called Deep Vein Thrombosis, or DVT. So let's say a person has a clot in their legs and this clot was not treated. Therefore, it's becoming larger, and as this clot is becoming larger, pieces of this clot is actually traveling to the other part, and they get traveled to the lung. So let's say here in the lung, we got up pieces of this clot traveling, and it came to the lung. In this case, in this condition, as we have pieces of this clot in the lung, this condition would be called pulmonary embolism, or PE. So anticoagulation medication, they can be used for DVT and PE, and this could be for prevention or treatment. The other condition is that if we have let's say we have in the heart, we have a clot in the heart. Once a clot forms in the heart, this is called a condition, acute coronary syndrome, ACS. And this condition is basically what's happening is that the amount of blood that is delivered to the heart is reduced. And that's due to the fact because we have a clot in there. So let's say we have a blood vessels, right? So this blood vessel, it's in the heart, and blood travels through these blood vessels. However, now due to the clot that has formed in the heart, so let's say we have a clot in there, and this clot's taken this form, this shape, and it's basically covering this whole area. So now the amount of blood traveling in this blood vessel has been reduced because this whole area from here to here is basically blocked via clot. So now the only spot is this spot over here that is allowing the blood to cross through. And this is why the blood delivered to the heart will be reduced due to this fact. And that's what happened in the ACS, or acute coronary syndrome. So now moving to the third type, which is prevention of cardioembolic stroke. So what happened is that if this clot in the heart, a pieces of it travel to the brain. So let's say here in the brain, a pieces of this clot travel over there. So in this case, if the clot travel from the heart to the brain, this will cause a stroke. And in condition where we have a stroke, we have a low amount of blood travel into the brain, and this can cause a tissue damage in the brain and could be fatal too. If a person left with a stroke for a longer period of time, that person actually can die from having the stroke. So now that I have covered the first objective, let's move into the second one. But before that, let me just answer one simple question, and that is, what is the most common adverse effect of anticoagulation medication? So these anticoagulation, what they do is that they prevent clot from forming. That's what they do. So the amount of clot formed is being reduced. Therefore, the chances of bleeding for someone increases with the use of these medications. So if someone using these medication in the excessive amount, the amount of bleeding or the chances of bleeding will be higher. This is why the most common adverse effect of this medication is basically bleeding. So now moving to the second objective, which is knowing where on the clotting cascade these medications works. So what is a coagulation? A coagulation is basically process of clot formation. That's what coagulation is. And what does it require? So coagulation to happen does require two things. So the first one is basically platelets activation. And the second one, so platelet activation plus clotting cascade. So for the coagulation to happen, it does require two things: platelet activation and clotting cascade. So clotting cascade has three pathways. What are these pathways? The first one is called intrinsic pathway. Second one is called extrinsic pathway. And the third one, which is the common pathway, because it brings both pathways together. So let's start with the intrinsic pathway. So in these pathways, basically what happens is that there are factors. And these factors, they're protein. And each one of them activate the other one in sequence in order to finally convert fibrinogen to fibrin, which actually what it does, hold the clot together. So, starting for the intrinsic pathway, the factor 12 gets activated to factor 12 active, which is, it's indicated with the A red, and this means this factor has been activated. So we have factor 12, which actually activate factor 11, which actually active factor 9, and then move into, with the help of factor 8, which is the activated form, we activate factor 10. Over here in the extrinsic pathway, we have two factors. The first one is the factor 7, which actually becomes activated factor 7, and we have tissue factor. With the help of tissue factor and factor 7, factor 10 gets converted to factor 10A, which is the activated one. And then factor 10A, with the help of factor 5, the activated one, we convert prothrombin, which is factor 2, to thrombin, which is the activated form of factor 2. And then factor 2A, which is the thrombin, convert fibrinogen to fibrin, and therefore we hold the clot with fibrin. This is why, in order to break a clot, we do need the fibrinolytic, which is the breakup of fibrin. This is why anticoagulation, they cannot break up a clot because it's basically held up with the glue, and that is the fibrin. So we need something that can break up the fibrin in order to break up the clot. So moving from the clotting cascade to the medication available right now to treat anticoagulation. So there are 4 types of medications. The first one is warfarin. So what warfarin does is that it's the inhibit vitamin K depending clotting factors. And there are 4 factors that warfarin works at. So there is factor 2, factor 7, factor 9, and factor 10. So we have factor 2, factor 7, factor 9, and factor 10. That's what warfarin works at. This is why warfarin is not specific when it comes in to inhibition of these factors. It can act on all of them. Moving to the second types of factors, it's called factor Xa inhibitors. And there are two types of factor Xa inhibitors. So there is the direct one and indirect one. The difference in between the two is that with the indirect one, it does require antithrombin in order to block 10A, factor 10A. Where the direct one, it does not require antithrombin. It can just come in and inhibit 10A. There are 4 medications under 10A, the direct one. There is rivaroxaban, apixaban, edoxaban, and batrixaban. For factor 10A inhibitor that is indirectly, there is one medication under that class. There is fondaparinux, and this one does require the binding to antithrombin in order to inhibit 10A. So moving from these two types to the third one, which is heparin. Heparin, there are 2 of it. There is N-fractionated heparin and there is low molecular weight heparin. These heparin, 2 types of heparin, they works on indirectly on factor 10A and 2A. So what they do is that they do require an antithrombin binding in order to inhibit 10A and 2A. For low molecular weight heparin, there are 2 medications under this one. The first one is called enoxaparin and the second one is called deltaparin. So again, heparin does require antithrombin in order to inhibit factor 10A and factor 2A. So now moving to the last types of medications. The last one is called direct thrombin inhibitors. So for direct thrombin inhibitors, these ones, they do not require any binding to antithrombin. They can just come in and inhibit thrombin. And there are 2 forms under this class of medication. There is the intravenous form or the IV form, and there is the oral form. So the intravenous form, there is argatroban and there is bivalirudin, and for the oral form, there is dabigatran. So these are the 4 types of medications and the clotting cascade. If you have any question, please leave them in the comments below, and thank you for watching.